Do you really know how to use your medical instruments? If no, then join me as in today's video, we'll be talking about how to use our various instruments. This video is sponsored by MedShop Ghana. They are very reliable whenever you need any medical equipment for your clinical and post-medical school. I'll leave their contact details in the description. So whenever you need them, you contact them. We are honored to be taught by Augustine Ajay. Augustine is a good friend of mine. So Augustine, welcome to the Medical Mind.
Sure. Thank you very much, Vincent.
And I'll be honored to be your patient today. The floor is yours.
Hello, everyone. So we are here, as said, to demonstrate how to use our medical equipment. And as you know, these equipments are being used in medical school and even beyond medical school. So stay tuned, even as I take you through the medical equipment, their names, their parts, and how to use them. We begin with the stethoscope, which is a very common equipment we all use. So this is a stethoscope, particularly Littmann. The stethoscope has three main parts: the chest piece, the hand piece, and the earpiece. So the earpiece is made up of the ear tips, the binaurals, and the brace. And the hand piece is made up of the tubing, and the chest piece is made up of the bigger diaphragm and the smaller diaphragm. The smaller diaphragm can be converted into a bell by removing this part and then inserting a sleeve in there to make it a bell. So with the bigger diaphragm, it's used for listening to higher pitch sounds, and the bell is used to listen to lower pitch sound. So with the stethoscope, realize that this part moves forward, or it faces forward. That is how we wear it. Enter into your ear. Do not wear it in this direction, which is facing you. That is wrong. Always wear it in the forward manner. So the stethoscope is used for auscultation, which means listen to the lung sounds, the heart sounds, and the bowel sounds. These are stethoscope holders, or we can call them the hip clip. We have the plastic ones and the leather ones. So to demonstrate, you have to be in an erect position. Then you use the clip, insert it into your belt, you open up. So you put in there your stethoscope in this manner. Then you coil around it in just this fusion. You stabilize the coil, then you close it. Yes. You put the stethoscope diaphragm in the middle, then you are good to go. With the uses of the stethoscope holder, it helps in convenience in handling your stethoscope. Around your neck, it might weigh you or be heavy weight on your neck. So this is a convenient way of storing it, and also for hygienic purposes as well, so that you don't contaminate it. These are wrong ways of using the tuning fork. These are tuning forks, and I have here the 512 hertz tuning fork and the 128 hertz tuning fork. They all serve their purpose, but mainly they are used for either bone conduction or to conduct a hearing loss assessment. It has the parts, the fangs, and the base, and the grip. So the grip, the fang, the base. So now I'll be showing you the right way of using the tuning fork. This is called the striker, or the tuning fork striker. So to use it, you strike at the fang this way. Then this is for assessing hearing loss. Same way for this, you strike at the fang. Then for conducting bone conduction at any bony prominence. Another function of the tuning fork is also to assess or analyze vibration at various body parts. These are pen torches, or you can also refer to them as pen lights. I have here the battery-powered pen torch and the rechargeable pen torch. You can see here its charger. So it has various parts. For this, it has the gauge of which you can set the frequency or the wavelength of light of which you want to project. And this one also has a switch and the chargeable slot. So for the uses of the pen touch, it's mainly used for checking for pupillary reflex, to check or analyze the orifice of the nose, mouth, and ear, and also to help you locate the internal jugular vein during the jugular venous pressure measurement. This is the patella hammer, or we can also call it the reflex hammer. This is particularly the Quinn type patella hammer, and this is the recommended type for medical students because it is flexible and easier to use as compared to the metallic ones you might have. These are the parts. So we have the crown with a rubber covering. It has the body or the stem, and it has the pin tip. So the pin tip is mainly used for pin prick and also for Babinski test. And this crown is for eliciting the reflex. So to demonstrate, I'm checking the knee reflex. So you hold the leg which has been flexed at the knee, you hold it at the popliteal fossa area, you palpate the quadricep tendon, and you strike it gently. But please mind you, your focus should be on the quadricep muscle, but the patient must be in shorts so that you can see the reflex occurring here. So this is a tape measure, particularly a retractable tape measure. So it has the container, the tape with the inches side and the centimeters side. And this is the grip or the tip. Now, to demonstrate how to use it, please always make sure that when using the tape measure, the inches side should face you and the centimeter side should be in contact to the part of the body you are measuring. The uses of the tape measure to demonstrate is mainly used for anthropometric analysis, which means to measure the skull or head circumference, limb length discrepancies, and then also to measure organ enlargements such as liver span and then spleen enlargements. We use the tape measure. Also, if you have a lump or a bump on any part of your body, we use it to measure. Oh yes, these are rulers, or you say they are straight edges. It's not only students, JHS or pre-tech students that needs these rulers, but also doctors need them. Why do they need them? Mainly for checking for jugular venous pressure or distension. Now the ruler has just basically two parts, the inches part and the centimeter part. To demonstrate how to use the ruler to check jugular venous pressure, the patient should be lying supine on a comfortable bed with the head tilted to the left. You use the pen touch to clearly locate the internal jugular vein. Then, with one ruler horizontally placed to the distension, the other at the sternal angle or the manubrosternal angle or the angle of Lewis, you can now locate your jugular venous pressure if there's a distension. This is a digital thermometer. We have several types, the analog, the mercury in glass. Now, this is the container for it, and this is the calibrated area or the stem. Then this is the battery inlet, and then this is the contact area. So the uses of the digital thermometer is used to check for temperature through several routes, such as through the mouth, the ear, the armpit, or even the rectal route. How do I look? You can see I'm matching with this equipment. It is called the stethoscope container or the stethoscope case. It has basically these parts, the zipper, the ID window, or you can see the base, and then the containing compartment for the stethoscope. One interesting fact is that when you buy this from medshopgh, you are guaranteed because it is waterproof, it is dust proof, and also it is a shock absorber for all your equipment stored inside. You are without doubt that they are fully protected. So now, let me show you how you arrange your equipment in the stethoscope case.
Augustine,
But
thank you for spending your time to teach us. I've really learned a lot today,
you're
and I hope
welcome.
my viewers too have learned a lot. You can order all this equipment we use today, together with other equipment and books such as Oxford Handbook for Clinical Medicine and Badger Volume 1 and 2 at medshopgh. All their details are in the comment section. Make sure to link them up and they will get you a nice deal. Thank you for watching this video. Make sure to like and subscribe.